quick things about scar massage before we kind of talk about scar tissue, before we talk about scar massage, is that everybody should know that when scar tissue comes in and forms, it actually forms in a very locked fashion. So when it comes in, it actually kind of webs itself like this. So it's not really mobile, it's not really flexible, okay? Regular tissues actually sit parallel so that they can glide and move and allow for flexibility and mobility. So scar tissue looks like this, regular tissue looks like this, okay? And for example, if I grab the bottom part of my shirt and I pull, you actually see that the whole shirt moves and is influenced. Even though the pull is only happening down here, the buttons move, the fibers move, everything changes. And that's essentially what happens with scar tissue after a C-section, is that scar tissue comes in, and scar tissue is normal. Everybody has scar tissue. It's part of the body's normal healing process. But it comes in and it locks up. And so even though it's only locked up here, it actually is going to pull through the abdomen. It can influence your digestion and digestive organs. It can influence your hips, your pelvis. I've seen it be a factor in pelvic pain. I've seen it be a factor in hip pain, a factor with exercise and working out. So it can actually wreak havoc, a lot of havoc that women just don't realize or know. So scar massage can be beneficial, and it can be beneficial at any point, meaning that even if you're 5 years postpartum, scar tissue and scar massage to that tissue, it can be beneficial. So it's still good to do, especially if you notice that your scar is really tight or you have any sort of discomfort in this kind of front area of your body, whether it's abdominal, sometimes even, like I said, digestive can be influenced, some tight hips or hip pain, or some pulling or some burning at the scar. Scar massage can actually still be beneficial even, like I said, years later. The one thing before you do scar massage is you want to make sure that your scar is well healed. So if you're pretty fresh postpartum, post C-section, you might want to ask a nurse or ask your doctor just to make sure it's well healed. You don't want to be massaging or rubbing it and have anything open up. So make sure that there's no kind of fresh spots that could bleed or could be irritated still. So everything needs to be well healed before you start doing any scar massage. When you do scar massage, I usually recommend people use lotion so you're not pulling on the skin, because sometimes that skin is already a little bit fragile. So a lotion that has vitamin E is always great, or just vitamin E itself, because it's good for scar healing. So that's always a good thing to use. I will tell some women sometimes too, even doing scar massage in the shower is okay. Just using the water kind of just to glide on so you're not pulling at the skin too much. But sometimes that's the only place that we get a moment to ourselves, and I get that. So doing it sometimes in the shower is okay too. So what you're going to do with scar massage, it's hard to show on myself, so I actually just drew a line. Hopefully you guys can see this on the video, on my forearm, and I'm going to just pretend that's the C-section scar and just show you what you should do. So you first, before you start, you want to do an assessment of the scar tissue just so that you have a baseline of what's the tenderness like, how tight is it, are certain spots tighter than another. And so the techniques you're going to use to assess are also going to be the techniques you use to actually do the massage. But I just like you to go through first and make a couple little mental notes so that you can assess the improvement as you continue to do scar massage. So regular tissue, not scar tissue, but regular tissue should really be pretty flexible and pretty mobile. Okay, so you can kind of see here as I move the skin on my arm, you know, it's all moving around pretty easily, okay? You'll a lot of times notice when you hit the scar tissue, it's going to be a lot tighter. You're not going to have that same mobility, and you want to try to, the goal is to get that mobility. So you're going to start first. I always have people use 2 fingers, and you're just going to go side to side, and you're just going to work the length of the scar, okay? And you're just, like I said, assessing for, is it equal? Does it move on this end the same as it moves on this end? Does it move the same in the middle? Is one side seem tighter? Is it more tender in one spot than another? Then the next thing you're going to do is you're going to go vertical, so you're going to go kind of up and down, okay? And then the last thing you're going to do is some rotations. So just some little circles, and it doesn't matter which direction. You just want to kind of move the tissue circular and just see if you can free it up a little bit. And then once you have kind of assessed where's tighter, I usually will have people work the entire scar, but if you do have one end, I know for me, one end of my scar is a little bit more bound down than other. So I sometimes will do a little extra at the end on that one section. So it's good to know if one section's a little tighter than another. 2 to 3 minutes, okay? You're gonna work in every direction. So, you know, back and forth, you know, up and down, circles. You don't wanna go that quickly. You wanna really just kind of take your time, work it through, and just go for a couple minutes. And there's no sort of, you know, specifics on it. You don't have to do so many passes one direction then another, and you don't have to go all in a row. You can just kind of alternate, here. As long as you're just getting in and moving that tissue, and like I said, using a little bit of lotion so you're not pulling, you're going to apply a good amount of pressure. This isn't just kind of a gentle rub. I mean, I'm kind of pushing in there a little bit and really just getting in and mobilizing it, especially if your scar is old. So if it's a couple years old, you're gonna probably have to get in there a little deeper because it's been sitting there for a while. Whereas if you're newer, within a couple months of your C-section, then you may not have to push as hard. You may also still have some sensitivity, so you don't want to push as hard if it feels really hypersensitive. So you want to kind of start gentle, but the goal is to really be able to get in there and kind of push and really work that scar. Couple minutes every day, and just assessing, like I said, kind of assessing the mobility before you start so that you can just kind of track your progress as you continue to do it. If you do have pain in that area when you are working out, sometimes I'll tell women to even just do a little bit of scar massage before you work out. It just brings blood flow into that area, which helps the tissues to reorganize and might make it a little bit easier to work out and have a little bit less pulling or discomfort in that area. So hopefully that helps. Like I said in the beginning, feel free to send me any messages or comment below if you have any questions or there's anything else I can do to help. But hopefully this is beneficial for the women I definitely was talking to, but maybe everybody else as well. All right, have a great night. Take care.